Hello, and welcome to a brief overview of Addison's disease. Addison's disease was first discovered and identified in medical literature by a physician named Thomas Addison in 1855. Addison's disease affects similar percentages of both males and females. In the United States, approximately 1 in 100,000 people are diagnosed, and in fact, President John F. Kennedy was diagnosed with Addison's disease. Addison's disease can potentially affect individuals of any age, but occurs usually between 30 and 50 years of age. So, what is Addison's disease? It is classified as a primary adrenal insufficiency. This condition occurs when a person's adrenal glands don't make enough of the hormone cortisol, and in some cases, it doesn't make enough of the aldosterone hormone. Let's take a moment and go over what cortisol is. Next up, aldosterone is in a class of hormones called mineralocorticoids. It maintains the levels of potassium and sodium in the body. These minerals control the salt and water balance within the body, keeps the blood pressure stabilized, and helps maintain nerve and muscle function. Symptoms of Addison's disease. If you experience the first test is the second test is the insulin tolerance test. An IV injection of insulin hormone is administered to an individual, causing the blood glucose levels to drop significantly enough to trigger hypoglycemia. Blood samples are taken before and every 30 minutes for 2 hours following the injection. Hypoglycemia triggers a stress response, signaling the body to release ACTH, which contributes to the release of cortisol. If little to no cortisol is present, however, it indicates insufficient production of ACTH by the pituitary gland. The third test is this. If you have Addison's disease, dosage of each drug is different for each person and may fluctuate according to factors such as infection or stressful situations to prevent an acute adrenal crisis. Other treatments can include things like an increased intake of salts in your diets. If the treatment works, a person with Addison's disease will have to take hormones for the rest of their lives with the occasional bouts of fatigue. And although they live long and healthy lives, some people can develop associated health conditions such as diabetes. If the treatments don't work, however, a person with Addison's disease will likely suffer from Addisonian crisis and will die without treatment. If left untreated, Addison's disease can quickly turn into Addisonian crisis, which is a life-threatening medical emergency. Symptoms of Addisonian crisis can include agitation, delirium, visual and auditory hallucinations, mental status changes such as confusion, fear, or restlessness, loss of consciousness, high fever, and sudden pain in the lower back, belly, or legs. This concludes our brief overview of Addison's disease. We hope that you learned something new and interesting. Thank you. These treatments are available, and they usually involve taking oral medication to correct the level of steroid hormones that are not being produced in the body. Hydrocortisone, prednisone, and methylprednisolone are usually used to replace cortisol, whereas fludrocortisone is used to replace aldosterone. In the case that you are ill and are vomiting up the oral medications, injections can be used. CRH stimulation test. IV injections of corticotropin releasing hormones are introduced into the body. Blood samples are taken before and every 30 minutes for 2 hours following the injection. If ACTH is absent in the blood samples, this indicates secondary adrenal insufficiency, which is caused by damage to pituitary glands. Adrenocorticotropic hormone test, or ACTH. An IV injection of manufactured ACTH is administered. Blood samples are taken before and 30 to 60 minutes after the injection. The cortisol levels in each sample are then measured. If little to no change in blood cortisol levels are present, this indicates adrenal insufficiency or Addison's disease. If the results of the ACTH test are unclear, however, the following tests can be conducted. It's the previous symptoms and you head to a doctor. Most likely, the doctor will ask you a series of questions about your general health history, as well as any present symptoms. There are 3 different tests that can be performed to check for adrenal insufficiency and help diagnose Addison's disease. These include muscle weakness, fatigue and tiredness, darkening in skin color, weight loss or decreased appetite, a decrease in heart rate or blood pressure, low blood sugar levels, fainting spells, sores in the mouth, cravings for salt, nausea, and vomiting. Neuropsychiatric symptoms can also occur, such as irritability, depression, lack of energy, and sleep disturbances. Up is aldosterone. Cortisol, also known as the stress hormone, is in a class of hormones called glucocorticoids. It helps the body to respond to stress, controls the body's blood pressure, balances blood glucose, which is blood sugar, and helps reduce inflammation. It also controls the metabolism.